Somebody asked me this question, Miss Mary. I thought yeast infection is found only in the vagina, it's found only in the female. Why am I hearing something called penile yeast infection? Does it really happen to the men? Do men have this yeast infection? And also, how common is penile yeast infection? Good day, everyone, and welcome back to Nurses Lecture Room YouTube channel. My name is Miss Mary, popularly known as a nurse with the difference, and I make learning easy and accessible for all my viewers. Today, I'm going to be talking about penile yeast infection. Yes, what are the causes? Who are at risk of going down with penile yeast infection? How is it being treated? How is it being prevented? But before I go into details into this lecture, if you are new on our YouTube channel, if your reproductive health is what you would like to know about, please click on the subscribe button, turn on the notification bell so you don't miss out. For all my returning subscribers, this is Nurse Miss Mary saying, Eshe, thank you. Right, welcome back. Like I earlier said, today I'm going to be talking about penile yeast infection. Yes, when people hear about yeast infection, the only thing that comes to their mind is the female. The only thing that comes to their mind is the vagina. They feel that yeast infection affects the female vagina alone and does not affect the male counterpart. Though the penile yeast infection is less common when compared to the vaginal yeast infection. The vaginal yeast infection is very, very popular. Yeah, when compared to the penile yeast infection. And I also want to let you know that this penile yeast infection is caused by Candida. Yes, Candida is a family of yeast. It is caused by Candida. And generally, this Candida is found in the body in low quantity. Or when there's an outgrowth, there's an upsurge of this Candida, that is where the problem comes in. And also, it can be gotten when one has or have unprotected sex with no condom with someone that has yeast infection. Now you know. But there are some certain people who are at risk, who are at a higher risk of getting this penile yeast infection. The first set of people, the first set of male counterparts that are at risk are those with poor personal hygiene. Men that don't wash their genitals, men that don't bathe regularly. They are at risk of getting this penile yeast infection. Then the second class of people I have is those that have weakened immune system. Weakened immune system as a result of the drugs they are taking. Their weakened immune system as a result of some certain medical conditions that they are battling with can actually predispose them to have what? Predispose them to have the yeast infection. Then the third set of people I have here is those that use antibiotics for a long period of time. People that have been using antibiotics for a long duration of time, that can give the Candida an opportunity to thrive, and that can predispose them to what? Predispose them to this penile yeast infection. Then another class of people are men that put on tight clothing, that put on wet clothing. They provide a warm, they provide a conducive environment for this yeast to survive, for this yeast to grow. These men are prone to what? This penile yeast infection. Then the other class of men that are prone to it are the uncircumcised men, men that are not circumcised. Yes, you know, when they are not circumcised, they have to pull their foreskin down in order to urinate. They have to pull their foreskins down when necessary. So that foreskin that's covering the penis provide a warm environment for this yeast infection to dwell effectively well. Then another men that are prone to this is using skin products, using irritants around the penis that can increase a man's chance of going down with this penile yeast infection. Then the other one is using unlubricated condoms. That might predispose one. Then having obesity might predispose one. Then having diabetes. This set of things I just listed, this set of people are at risk of going down with what? They are at risk of going down with penile yeast infection. That takes us to the signs and symptoms. Yes, I want to tell you about the signs and symptoms of this penile yeast infection. So the first one I have to share with you is redness, soreness, or swelling on the top of the penis. Then the second one is white patches on the top of the penis. Then the third one I have to share with you is red spots can be found. Cracked foreskin, you know, the foreskin surrounding the penis. You know, we said that one of those that are at risk of getting it are men that are uncircumcised. So when you are getting a cracked foreskin, that might signify what? That might signify a penile yeast infection. Then another sign that you might experience is burning sensation, itching around the penis, burning sensation during urination. Another sign I have here is thick white discharge from the penis might be a sign. Another one I have to share with you is difficulty pulling the foreskin when necessary. Normally, as an uncircumcised man, it's easy for you to pull the foreskin, but now you are finding it difficulty pulling the foreskin. Then another one I have is pain or discomfort during sex. So these are the signs and symptoms you are expected to, or the clinical manifestation you may likely see when you have a penile yeast infection. That takes us to the various treatment that is needed to help with penile yeast infection. And the treatment, as obvious, is some antifungal treatment. And most countries, this antifungal treatment can be gotten over the counter. You can get these medications over the counter, such as your clotrimazole, imidazole, and micronazole. So these are various medications that can be treated. They have different brand names in the pharmacy. So they might not call it clotrimazole in the pharmacy. They might not call it imidazole in the pharmacy. They might not call it micronazole in the pharmacy. So they have different brand names in the pharmacy that might likely going to help you get it in your country. And also note that for diagnosis, for them to do a test, they will take those samples from the penis and take it under the microscope. They'll view it, and that gives them a clue, a definite diagnosis. Oh, this is really what and what is wrong. So then that takes us to ways on how to prevent this penile yeast infection. Prevention, in terms of prevention of penile yeast infection, the first one I have to share with you is for you to practice good personal hygiene. Whenever we hear personal hygiene, anything that comes to our mind is the female. The next thing that comes to our mind is the vagina. So what I'm advising you is to practice good personal hygiene, bathe regularly as a man, and also wash your genitals proper. The second prevention I have to share with you is avoid wearing tight boxers, avoid wearing wet boxers or wet clothes generally. Always put on boxers that are free, that can allow air to circulate around the penis. So wearing tight boxers, wearing tight clothes, wearing wet clothes, wet boxers might not be good for the penis, might increase your chances of going down with penile yeast infection. Then the third one I have to share with you is avoid partners with yeast infection. The fourth one I have to share with you is for you to wear an external condom. Yes, use a condom. It reduces the chances of you getting penile yeast infection. Then the last one I have to share with you, if you are uncircumcised, your doctor may advise you get circumcised, because you know the foreskin actually covers the penis, provide that warm environment for the yeast to thrive, for the yeast to grow. So when circumcision takes place, at least there is no warm environment. Nothing is giving the yeast an environment to thrive. So this is the prevention I have to share with you, and I hope I have been able to make it clear that men also have this yeast infection, the penile yeast infection. Thank you very much for staying tuned. Thank you very much for watching our video. Don't forget to like, don't forget to subscribe, and also don't forget to share with a friend if you got value. For all my returning subscribers, this is Nurse Mercy Mary saying thank you. Bye, and see you in our next video.